Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have one more type of gastrectomy which is not used much, which is called as polygastrectomy. There is polygastrectomy. So in polygastrectomy, it is actually a modification of Billroth 2 operation, and it is a type of posterior gastroenterostomy. It is a type of posterior gastroenterostomy where you do resection of two-thirds of the stomach. It is similar to this one. It is almost similar to this one, but it is done posteriorly. Right. So here you do, right. Here you are doing first resection of two-thirds of the stomach is done. Okay. Then followed by resection of two-thirds of the stomach, you will close the duodenal stump here. You will close the duodenal stump here. Followed by you do the anastomosis of the stomach with the duodenum. But here this anastomosis is done behind the colon in the polygastrectomy. In the polygastrectomy, this anastomosis is done behind the colon. So here you will see that there is a colon here, and this anastomosis is actually done behind the colon. Okay, so this is polygastrectomy.
thank you and thank you for watching.